Hi, this is Mark. I'm a PT in the MetroWest Boston area with 10 years of experience in the field. I have my bachelor's degree in rehabilitation sciences from Northeastern, as well as my clinical doctorate in physical therapy from Northeastern. And I want to share a recent experience of working with an 83-year-old gentleman. Just recently underwent the autologous stem cell therapy with Dr. Janet Pearl. He chose this intervention over traditional joint replacement surgical options, and he came to me inquiring about stem cell therapy, their medicine, and I had known this patient before. He underwent the treatment with Dr. Janet Pearl, and we discussed possible outcomes with both options, and he did decide to undergo the stem cell therapy treatment, and he came to me after treatment. He did not start his therapy beforehand, but he had physical therapy in the past, and he had arthritis in both knees, and he kind of knew where he was, and he wanted to get better, but he just wasn't ready to have joint replacement at that time. And when he started physical therapy, his pain levels were probably about a 6 or 7 out of 10 bilaterally. His right knee a little bit more involved than his left knee. His range of motion on his left side, he was lacking 9 degrees of extension, and his flexion was 110. His more involved side, his right knee was lacking 11 degrees of range of motion, and his flexion was 97. And a couple months after the stem cell therapy and a couple rounds of the PRP treatment as well, and along with physical therapy that went along with the stem cell therapy treatment, his range of motion was able to improve on his left side, getting full extension with assist. His flexion range of motion was able to increase to 125. On his right side, his extension was able to improve to only lacking 5 degrees versus 11 with overpressure and assist, and his bending his flexion was able to increase to 115. So he did have remarkable improvements within his range of motion in only a couple of months of the therapy. And his pain levels were much more manageable. They were able to come down to about, more of a 3 out of 10, probably on average. And more importantly, functionally, he felt more comfortable with prolonged walking, prolonged standing, stair negotiation. He was feeling stronger as well. Talked extensively with Dr. Pearl, just kind of going through all the pros and going through the research and, what would happen if he didn't get the results he was looking for. And at this time, he's not considering undergoing a joint replacement bilaterally, and he's continuing with his physical therapy. And he's on course, and he's responded very well. And I've been happy to work with him, and I've been happy to work with Dr. Pearl in her practice. It's been a very positive experience, positive outcome, and hoping that more patients have the opportunity to explore this option.